Welcome to Module 21, Multidisciplinary and Community-Based Wound Care. By the end of this session, you will be able to define the roles of key disciplines involved in wound care teams, explain how interdisciplinary collaboration enhances outcomes in wound healing, describe the structure and value of community-based wound care models, such as home health, outpatient wound clinics, and telehealth. Identify strategies for coordinating referrals, documentation, and follow-up care in multidisciplinary settings. And finally, apply best practices for ensuring continuity of care and equitable wound management, especially in underserved or rural populations. Wound healing is rarely the job of a single provider. It's a team-based effort. Chronic and complex wounds benefit most when care extends beyond the surface, to include nutrition, circulation, mobility, infection prevention, and psychosocial support. As healthcare moves toward value-based models, collaborative and community-integrated care is vital to reducing hospitalizations, amputations, and overall costs. In many cases, nurses serve as the central coordinator of this care network, ensuring seamless transitions between settings and services. Let's review the core members of a wound care team and their roles. Wound care nurses are often on the front lines, applying dressings, assessing wounds, and educating patients. Physicians provide diagnosis, debridement, and order advanced therapies. Dietitians help manage malnutrition, glucose levels, and protein needs. Physical therapists, or PTS, improve mobility, offloading, and range of motion, while administering compression therapy when needed. Social workers support with housing, finances, and caregiver coordination. Podiatrists are crucial for managing diabetic foot ulcers and biomechanical issues. Vascular specialists handle peripheral artery disease, venous insufficiency, and surgical revascularization. Mental health counselors provide emotional support for patients coping with pain, isolation, or trauma. And pharmacists play a key role in pain management, antibiotic stewardship, and medication safety. Every discipline contributes to the larger healing picture. When teams collaborate effectively, patient outcomes improve. Some key benefits include faster wound healing through combined expertise, fewer medication or dressing errors thanks to shared health records and care plans, better follow-up and reduced no-show rates, higher patient satisfaction and adherence to care instructions, early detection of social or environmental barriers, such as food insecurity or inadequate housing, and reduced rates of readmissions or emergency visits. Multidisciplinary care is not just better, it's safer, more efficient, and more holistic. Community-based wound care extends healing into the patient's everyday life. Let's look at 4 common models. 1. Outpatient wound. Clinics. These are staffed by wound specialists and physical therapists. Services may include negative pressure, wound therapy, debridement, hyperbaric oxygen therapy, and skin substitutes. They're ideal for patients in the post-discharge phase who still need close monitoring. 2. Home health. Wound care for patients who are homebound or have limited access to transportation. Visiting nurses may coordinate care via discharge planners and skilled nursing facilities, often integrating telehealth and remote monitoring tools. 3. Mobile wound teams and community nursing. These teams travel to long-term care facilities, rural clinics, or even shelters. They're especially valuable for pressure injury prevention and continuity of care in high-risk environments. 4. Telewound care uses image sharing and video consultations for remote wound assessment. It's a powerful tool for reaching rural or underserved populations, reducing the burden on high-volume wound centers. Care coordination is at the heart of multidisciplinary wound management. Best practices include using structured communication tools like SBAR or standardized electronic handoffs, documenting wound characteristics, size, tissue type, exudate, and interventions in a consistent format, tracking referrals to specialists and confirming follow-ups, scheduling interdisciplinary rounds or case reviews weekly or bi-weekly to align care plans, sharing patient summary sheets across care settings to avoid conflicting treatments. Nurses often serve as the linchpin, tracking healing progress, reconciling orders, and keeping all disciplines informed. Social determinants of health play a critical role in wound outcomes. Barriers include lack of transportation, insurance, or healthy food, language and cultural gaps in understanding care instructions, homelessness, caregiver fatigue, or physical disabilities, and communities, such as tribal or rural areas, that may lack wound care infrastructure. To address these challenges, we must partner with public health agencies for prevention and education, engage community health workers for in-home support, use local pharmacies, churches, or senior centers for screening events, and advocate for Medicaid or Medicare coverage of essential wound care supplies and transportation. Equity in wound care means meeting patients where they are, not where the clinic is. Let's revisit the nurse's vital role. Clinical coordination. Nurses serve as the bridge between hospital, clinic, and home care settings. Advocacy. They champion the patient's needs, financial, cultural, and clinical. Education. Nurses explain why each team member matters and guide patients in understanding their care plan. Follow-up. They help set appointments, ensure dressing supplies are delivered, and confirm telehealth readiness. Outcome monitoring. Nurses track healing markers, pain levels, nutritional status, and overall compliance. In short, nurses make multidisciplinary care possible. Multidisciplinary and community-based wound care is the gold standard for managing complex wounds. Healing is not just about applying the right dressing, it's about integrating medical, emotional, nutritional, and environmental support through a collaborative team effort. By understanding the roles of each discipline, coordinating across care settings, and expanding wound care access into homes and communities, nurses help ensure patients receive continuous, equitable, and compassionate care, from admission to complete healing. Congratulations! You've successfully completed all modules in our comprehensive wound care training program. Throughout these 21 modules, we've explored the science, art, and clinical best practices of wound assessment, treatment, prevention, and interdisciplinary collaboration. Whether you are a new nurse, an experienced provider, or a caregiver, your commitment to learning and improving wound care outcomes is commendable and truly impactful for patients and communities alike. Thank you.